Hello, and welcome to Direct from the Doctors, a live stream session Blue Cross and Blue Shield of Louisiana is proud to host to share information with you about health topics. We're hoping to answer some questions you may have, address your concerns. And right now, we know that the big topic on everyone's mind is the COVID-19 vaccine. So today, we're going to share facts about the vaccine, hopefully provide some reassurance about the vaccine, clear up some myths that are out there. And we're also going to address your general overall care, things that you should be keeping in mind right now. I'm Dr. Emily Vincent. I'm a medical director for Blue Cross and Blue Shield of Louisiana. And today I'm so happy to have joining me my friend and coworker, Dr. Tracy Lemelle.
Hi, I'm Dr. Tracy Lemelle. I'm also a medical director at Blue Cross Blue Shield, and I'm a pediatrician by training. And I'm so glad to be here so that we can reassure everyone that the COVID-19 vaccine and immunizations in general are safe, effective, and one of the best tools we have for the purposes of protecting the public, your family, and the public health. Blue Cross is proud to partner with other member organizations of the Baton Rouge Health District on their COVID Safe campaign about the vaccine. You can visit brcovidsafe.com to see videos and testimonials from Louisiana healthcare professionals about their experience getting the vaccine and why this is so important to protect the health of everyone in our community.
So let's go ahead and dive right in. We've gotten a lot of questions leading up to this live stream event, and we're really excited that you're also excited about participating and you have interest in the topics today. Um, One of the things that I'd like to mention to you is that you can continue to add your questions in the comments section on this live event, and we will try to address as many questions as we can as we go through. Any questions we can't get to, we will go back afterwards and try to provide answers for you. So speaking of Facebook, let's talk about credible sources for COVID-19 information and COVID-19 vaccine information. Aside from this event, Facebook's not one of them. So in general, social media is not going to be a great place to pick up your information about COVID-19, the vaccine, or any health related topics for that matter. Keep in mind, anytime you are going to look for health information on the internet, you need to make sure that the sources that you are viewing are reliable. There's so much information out there that is false, not backed up by fact, and it's really more dangerous to get this type of information than not to have any information at all, honestly. But for COVID-19 vaccine, some good resources are the Center of Disease Control and Prevention website, the CDC, the Louisiana Department of Health, which will also give you good timelines for the COVID-19 vaccine in our state currently. And the FDA also has some good information about COVID-19 vaccine and COVID-19. As for your personal situation, if you have individual questions about your health and your individual health history, the best person always to answer those questions is your provider, the person who is taking care of your health conditions with you. They know you the best, they know your health conditions, and they're really going to be the best resource for you.
Yes, particularly for health topics and vaccines and immunizations in general. Like Emily said, there is so much misinformation out there. And the combination of fear of the COVID vaccine combined with lack of information or incorrect information is deadly all around in general and in medicine in particular. So if you do have questions, please call your healthcare provider. That's what we're there for. That's what we were trained to do. Tell them what you're hearing, tell them what you're worried about, and ask them their advice. I tell the parents of my patients all the time, I would much rather them come to me with a question than to make important health decisions based on an online post. So that's our job. That's what we do. Ask us. It's okay. That's what we expect you to do. I I tell parents all the time, the thing I always ask even when I go to the physician, tell me what you would do for you, for your mother, for your sister, for your children. And I follow that advice and think of it that way. Every health situation is different, but you need to know that the sources where you're getting information are reliable and trustworthy. And you can't always bank on that on Facebook or Twitter or Snapchat or Instagram or wherever. But the CDC, the Louisiana Department of Health, the American Academy of Pediatrics, all of those are great sources that have proven clinically correct information for you and your family.
That is so very true and great information. And as we're talking about going to your provider to speak to them about the COVID-19 vaccine, that's a great opportunity to also have your annual wellness visit. Everybody needs at least one annual wellness visit a year. There are certain markers that we need to be checking every year. Our blood glucose, for example, may be something we need to check depending on our risk factors. Our blood pressure, we definitely need to check every year. Depending on our health history, there may be other things. And if you know you have chronic medical conditions, those things need to be followed most likely more than once a year. Your provider will tell you the timeline for that. During the pandemic and the stay-at-home orders, it is absolutely known that people stopped going to their providers. Well, first, we were told to stay at home. And second of all, there was a lot of fear, and understandably so, about leaving the home and going out into providers' clinics. Rest assured that most providers are doing an excellent job of making sure that when you go to their office, it's a safe experience. And certainly it is safer than letting your chronic medical disease get out of control. It would be a shame to get through the COVID-19 pandemic only to realize that you have an undiagnosed health condition that has developed over the year and could have been controlled or improved with timely care, or to learn that your chronic health condition got out of control because, again, you weren't being seen. So make sure that you're scheduling your visits that you need. While you're there, take that opportunity to ask about your specific medical condition and the COVID-19 vaccine and whether or not it's right for you at this time. In addition, don't forget that there are wellness things that we need to keep in mind. For women, it's mammograms over a certain age. We need to be having those annually. For individuals over 50, we have to consider colonoscopies, and your provider will lay out the timelines for those. For men of over certain ages, prostate exams and PSA checks may be necessary. So your provider needs to see you to be able to tell you what is necessary and what is next. So use the opportunity now, schedule your visit if you haven't seen them in a while, check up on your chronic conditions, make sure that your screenings are done, and get scheduled for those wellness exams that need to occur.
The same thing is true for children. Across the country, we're seeing the rates of timely childhood immunizations decline for the same reasons that Emily spoke about. People were at home, they were trying to stay safe, but they missed some appointments and children have gotten behind. And as she stated, the last thing you want is to do everything possible for your child to keep them from getting COVID, only for them to get the measles or chickenpox because you were behind on vaccines. So children above the age of 2 should be seen yearly, and that's healthy children. If your child has asthma or any other chronic disease, it could be more often than that. Children under the age of 2 get seen more often because they get more vaccines while they're young and their immune systems are raw and eager to take on illnesses and protect them against them. But they also get seen more often because they're growing so quickly developmentally. So we want to make sure, their height, their weight, their speech, their gross motor, all of those things are developing appropriately. So for children under 2, more frequently, for kids over 2, at least once a year. And also you're going to take that time to talk to your doctors about other concerns you may have about your children, how they're performing in school. With distance learning, there are lots of complications to that, and children have gotten disengaged, and there's been many more incidences of inattention and easy distractibility because they're not in a school setting. So if you want to talk about those kind of things, or if your children want to participate in sports and you want to make sure they're healthy and able to do so, that's the time to do it. So get in to see your children's primary care physician. From my standpoint, I always say that most parents are better about taking care of their children than they are about taking care of themselves, but we need both of you to be in good shape, particularly during this time.
Absolutely. So speaking of COVID-19 and the vaccine, which again, we're here to try to answer questions and provide reassurance. Let's go through some of those myths that are out there about the COVID-19 vaccine because there are a lot of them. And I'm going to start with this one. You can't get COVID-19 from the vaccine. The vaccines that are out there right now that are approved, at least the ones in distribution, the Moderna and the Pfizer, are not live vaccines. So that means that there's not actually live COVID-19 virus in the vaccine that they're administering to you. We've all seen the pictures, the graphics on the TV and the internet of COVID-19. It looks like a little circle almost with these spikes coming off of it. So what the vaccine is actually doing is it's telling your body what that spike is going to look like that's on the virus. That spike protein is how the virus enters your cells. And so if the body knows to be on the lookout for this spike protein and it's already developed antibodies to the spike protein, then when you get COVID-19 or exposed to it, it's already going to have what it needs to stop the virus from entering your cells, from replicating and causing you to have serious infection. So yes, you can get side effects from the vaccine, like sore arm or achiness, low-grade fever, fatigue, just generally feeling kind of blah for usually around 48 hours if you're experiencing those mild side effects. But know that that's actually a good sign. It means that your body is ramping up its immune system. It sees that this is something that it shouldn't have, and it's learning how to fight off COVID-19 so that when you are actually exposed to it, it's ready.
Absolutely. Another, and to kind of catch on to what Emily said, while COVID-19 is a new virus, the vaccine isn't new. It's based on decades of medical research and vaccine technology that have helped develop it. And a lot of people are very concerned about getting this vaccine because they feel like it happened so quickly. Well, there are lots of reasons why it happened quickly, and it was kind of the perfect storm in some good and some bad ways. Um, the primary reason is scientists all over the world were able to start working on the vaccine before it actually came to their country, because cooperatively, other scientists had determined the genetic makeup of the COVID vaccine and made it available to everybody. So countries that had not yet been exposed were able to start working on vaccines without having a bunch of sick people present first. So that's one reason that it moved a little quicker. The other reason is because this virus is so deadly, lots of people were actually very eager to participate in vaccine trials, and that's not always the case. So we had lots of people available to learn how these vaccines would work in humans against the virus. And lastly, and most importantly, there was a lot of virus to be had. In the United States, as of right now, we've had 28.3 million cases. So it takes much less time to determine if a vaccine is effective if you have that many people getting sick. In contrast, Ebola, I think there was one person in the United States, maybe up to four with Ebola. How long does it take you to determine how effective an Ebola vaccine if there are four people in your country who've had it, as opposed to 28.3 million? So all of those things helped move the vaccine process along a lot quicker than it would ordinarily occur. That doesn't mean that any steps were skipped. They still went through rigorous testing and to make sure that the vaccine was safe before they were given um, to the population at large. But fast doesn't mean ineffective. It doesn't mean scary. It doesn't mean dangerous. It just means that we kind of had a situation that worked in our favor from a vaccine standpoint. So you shouldn't let those things scare you from getting the vaccine, because in all, despite as fast as it went, 75,000 people participated in vaccine trials for the 5 vaccines that are available. So it's been tried and tested, and we're very comfortable with its efficacy and how safe it is.
That's a good point because you mentioned fear out there, and right now there is a lot of fear from women of childbearing age because there's been concern about it affecting fertility. And know that there's no valid information that states that this is going to affect your fertility for a woman in childbearing age in any way. The way the vaccine works really has no part in affecting anything that would cause problems with fertility. One of the things that you should really be concerned about more is that if you are pregnant, you do have a higher risk of having a worse complication or worse course of COVID-19. So you should be speaking to your obstetrician about getting the COVID-19 vaccine for your protection as well as for the protection of your unborn child.
As Emily stated earlier, the Moderna and Pfizer vaccines, which are the only two vaccines that are licensed to be used in the United States, they are mRNA vaccines and they will not affect your DNA. I've seen some things out on social media that this will alter your DNA. That's not accurate. M in mRNA stands for messenger RNA. And as Emily discussed, mRNA vaccines teach our cells how to make a protein that will trigger an immune response. So those spikes on top of the COVID vaccine, they're called spike proteins. So the mRNA sends a message to your cells to tell you how to make this protein. And when that protein gets made, your body develops an immune response to it. The mRNA from a COVID vaccine never enters the nucleus of your cells, which is where your DNA resides. So by this, because it doesn't do that, it can't affect or interfere with your DNA in any way. So it's not a concern you should have because that's just not how it works.
That's true. And it also, apart from just affect the concerns of people that it would affect their DNA, people have a lot of concerns about allergic reactions they may have to the vaccine. What I'll say here is that it is very rare to have a true allergic reaction to a vaccine. There are a couple of cases. I can't really remember even hearing many more that they're investigating right now with the vaccine of possible allergic reactions, but think about how many have been distributed and you've only heard of the possibility of maybe 2 individuals having allergic reactions. At least that's what I've seen, in the media. But true allergic reactions to vaccines are very rare. I've hardly, if ever, seen a reaction to a vaccine in my career that I can attribute, truly it was a true allergic reaction to that vaccine. But keep in mind that your chance of getting COVID-19 and having complications from COVID-19 or having a very severe course of COVID-19 far outweigh your chances of having any kind of allergic reaction to the vaccine. So I still think, by and large, the vaccine's the safer choice in this situation. But if you're concerned, remember, if you've had you're allergy prone, or you have had allergic reactions to other vaccines in the past, or something you think may have been an allergic reaction, talk to your provider. Always the best person to check in with before you sign up for the vaccine.
Absolutely. And as Emily said, allergic reactions, we're not talking about you got a few bumps, it turned a little red. We're talking about severe allergic reaction. These are the people who are really at risk, who may have a difficult time with the vaccine, and they need to talk to their providers, but they tend to know who they are. Those are those people who carry an EpiPen around with them. We're not talking about the sniffles when springtime occurs and there's pollen out in the air. It's very different. But also, there have been lots of questions about whether or not you still need to take precautions to slow the spread of the virus, even if you've had a vaccine, and you absolutely do, for multiple reasons. One, we're still learning about the effects of the vaccine on the virus, in as much as if you get the vaccine, can you still get COVID? It is a small possibility, but the disease is very different after a vaccine than it is without a vaccine. But if you have a minor case of COVID after the vaccine, can you then spread COVID? So we don't know the answers to a lot of these things. It's unlikely, but we can't be 100%. So it's always better to be safe than sorry. So you still need to be wearing your mask. You still need to be washing your hands and keeping your distance. In addition to all of that, you don't know who else has been vaccinated. You have no way of knowing if the lady in the checkout line next to you is vaccinated. So to be a good citizen and to care for your fellow citizens, it is always best to be precautious. You always want to do those things until we know where we are. Because at this point in time, we don't know how many people have to be vaccinated to have what people call herd immunity, or to be able to lower the way we live or improve or change the way we live right now. So because we don't know those things, and if you add on that the risk of new variants from from South Africa, thank you. I was going to say South America, from South Africa and from Britain. That only adds. We believe that these vaccines will help with variants, but we don't know 100%. We do know that it's better than nothing, but still, that's why you still have to wash your hands and wear your mask and keep your distance. It's very important.
We so badly want to get back to a more normal life, right? And herd immunity is what we all hope to establish because we think that's probably our way out. But one of the things you need to know is that you can't pay to jump the line and get the COVID-19 vaccine. Right now, Louisiana they've laid out a plan for who's eligible and when. You can actually access that on the Louisiana Department of Health website if you want to see the tiers and how they've prioritize the vaccine. This week, I was excited to hear that our teachers are now eligible for the vaccine. So you can look down the tiers and you can see, okay, well, now we're at teachers and who's next. So you can see. I mention this because with any situation in life, scammers are always out there, right? It's unfortunate, but that is just our reality. People are looking to take advantage of us at any given turn. And this is no different. There have been multiple reports about people coming and approaching individuals saying that if you pay them or if you provide them your social security number or some sort of sensitive information, they can get you the COVID-19 vaccine sooner. Know a couple of things. Number one, like I mentioned, Louisiana has laid out a plan for the tiers of eligibility for this vaccine. Number two, the CARES Act right now states that the COVID-19 vaccine is going to be provided at zero cost for all of us in 2021. We're all going to be eligible should we be willing to take it, at least right now for the ages that have been studied, which is 16 for one of the vaccines and up, 18 for one of the vaccines and up. And they're currently bridging the gap with the younger ages in clinical trials that are ongoing. But we're all going to be eligible. There is a time frame. We shouldn't have to pay for the vaccine. And so you should be very apprehensive and cautious if anyone approaches you asking you for this kind of information. Hey, give me your social security number, your bank account number, pay me $100, anything like that. More than likely that's a scam. You need to walk away. Even if your provider or someone calls claiming to be your provider, reaching out to you about the COVID-19 vaccine, just double check, make sure they are actually who they are saying they are when they call you. Just be very careful. So I think that's really the myths we kind of wanted to clear up, but we do have a lot of questions that came in that we would like to address. I'm going to actually pull my list of questions that came in before the Facebook live event. So I'll make sure that we address the ones that came in. And then after, if we have some time, we'll certainly address some of the ones that are coming in the comments section. Thanks again for your willingness to participate in this. So I'm going to group some of your questions that came in into this category. There were quite a few questions that dealt with very specific disease processes that you may have, or immunocompromised conditions, meaning you have a weakened immune system, whether that be because you have cancer, you're on chemotherapy, you're on immunosuppressive drugs for a condition, or prednisone as an example for a condition. Currently, the CDC, and this is straight from the CDC, they say that there's just not data right now available to tell you or us as providers with 100% certainty what your body's going to do with the COVID-19 vaccine regarding making antibodies. So that means that I can't tell you you're going to make the same amount of robust antibodies as somebody else who doesn't have a weakened immune system. We just don't know that. we all have to understand that because it is relatively, a new vaccine, we don't have all of the clinical trials for every scenario out there right now to tell you what's going to happen. But the CDC is also saying there are current trials ongoing with people of various health conditions, weakened immune systems including, so they should have information. But the best person, I keep saying this, it's gonna sound like an echo, but the best person to check in with is the provider who takes care of that individual medical problem for you. So whether that's your oncologist or your rheumatologist, that is the provider who more than likely has the best information about your disease process and how you're going to react with the COVID-19 vaccine. I will say that I have not seen any reports saying that you shouldn't take it. I'm still continuing to see evidence that you should still take the COVID-19 vaccine, because even if we don't develop the same number of antibodies that the next person does, some antibodies are better than no antibodies. Some ability for your body to recognize the virus as it gets exposed to you is better than no ability to fight it off at all. So that's how I'll answer those. Again, I know that that's not the most definitive answer there, but I just want to be absolutely truthful with the information that we have from reliable health sources.
Okay, I'm going to take the next question. So bear with me. You're going to see me looking down to read to make sure I get people's questions correct. There's some debate about if the vaccine actually prevents your ability to contract COVID or just lessens the severity of the symptoms if you do catch it, which is true. Well, both, quite frankly. So let's talk about efficacy for a second. The two vaccines that are currently authorized in the United States by Moderna and Pfizer both have roughly about a 95% efficacy rate. What that means is, of people who received the vaccine, 95% did not get COVID. So they did not test positive for COVID. What you have to keep in mind, though, is if you got COVID and had no symptoms, that's considered a vaccine failure. If you got COVID and had 3 days of cough and nothing else, that's considered a vaccine failure. So from a symptomatology standpoint, these vaccines are exceptionally good. It's amazing how wonderfully they work, much better than almost every other vaccine out there. It's fabulous. But so that means, like I said, 95% of people don't get COVID after taking the vaccine. So it prevents a lot of people from getting COVID at all. But those who did, that other 5% who did get COVID, had very mild to minimal symptoms, which is still better than no vaccine at all. So the vaccine will keep you from getting COVID. But if you do get COVID, even having the vaccine, it's a mild case. So overall, it's exceptional. So of the 32,000 people who received either the Pfizer or Moderna vaccine, one had a severe case of COVID and 0 died. And that's of all the vaccines. There are currently 5 vaccines out there that we have information about, COVID vaccines, Pfizer, Moderna, Novavax, help me out, AstraZeneca, and Johnson & Johnson.
Yep.
And of the 75,000 people who took any of those vaccines, there were 0 deaths. And that is amazing.
Huge.
Right. Because I can't tell you any other vaccine that has that type of effect, particularly as people talk about in such a short time, given all the information we have. That's huge. Because even if you take the flu doesn't have that kind of efficacy. Not saying you shouldn't take your flu shot. You should take your flu shot.
Right. Yes, please do.
I want you to understand how impressive that is. So yes, the vaccine will keep you from getting COVID. If you do happen to get COVID, even though you had the vaccine, the likelihood of you having severe disease is dog near 0. It's minimal. So I hope that answered the question.
Love it. That's a great answer. I'm going to address the diabetics next because we had a question beforehand and then I see one in the comments section. So I'm going to wrap up those together. The question is pertaining to elevated blood glucose after taking the COVID-19 vaccine. And so the way I'll answer this is that we know with diabetics that anytime you have any kind of your body's under a stress response or an inflammatory response, it's possible that your blood sugar will go up as well. Now, note, every person is different. This doesn't happen to every diabetic. You know that, hey, last time that I got this severe head cold and ended up with a low grade fever, my sugar went up. So you know your body, you know what your diabetes tends to do. So you may already know if you're one of those people who's prone to this. So if you know this is the possibility for you that your diabetes tends to have an elevated blood sugar when it faces an inflammatory response or a stress response, and even if you're just diabetic who's never experienced this, my advice would be to speak to your provider who manages your diabetes, whether that be internal medicine provider or an endocrinologist. Express your concerns, and if you've had the COVID-19 shot and your diabetes did have an increase of your glucose surrounding the vaccination, express your concerns to a provider regarding the follow-up vaccine, that next vaccine that we all do need to get, at least for the Moderna and Pfizer. It's a two-part vaccine. You're not done after the first one. What your provider may advise for you is increased hydration, a change possibly of your diet surrounding the vaccine, and possibly even a change of your medications surrounding the vaccine, and increasing your blood sugar checks over that 48-hour period. Know that for the majority of people, the side effects last over under 48 hours. And so I would expect that the hyperglycemia would be temporary, but again, the person who helps you manage your diabetes will help you to lay out what we call a sick plan, so that if that does happen, you have a plan in place to manage your blood sugar. But do not let that deter you from getting the COVID-19 vaccine. We know with 100% certainty, diabetics are the people who are in that high risk category for having a bad outcome from having COVID-19. So please get the information you need, but don't not get the vaccine because of that fear.
I'm looking at the time. We are running out of time, but I'm still going to answer questions until somebody kicks me out.
Yeah, that's a good idea. I think we can.
Until they turn us off.
Yeah.
Another question I have is, how soon after getting the COVID vaccine will it be okay to get my shingles vaccine? Should I just wait a few months more to get my shingles vaccine? Actually, the CDC's recommendation currently is 14 days. So 14 days after getting your COVID vaccine, you can get your shingles vaccine. If you have gotten your shingles vaccine less than 14 days from your COVID vaccine already, they're not recommending you retake vaccines. They're not saying you're going to turn purple. None of those things. We're just going to watch it and see how it does. But the actual recommendation is 14 days if you need to know specifically.
I'm going to address the next questions, and I'm going to group a couple of questions about lessening side effects and about the concern of taking non-steroidal anti-inflammatory drugs surrounding your COVID-19 vaccine. So this information is coming straight off the CDC website because, again, there's a lot of information out there, misinformation. What the CDC says is that it's not certain how non-steroidal anti-inflammatory drugs affect the COVID-19 vaccine. They're not saying that it prevents the COVID-19 vaccine from working. They're saying that we just don't know right now. So what their advice is that don't pre-medicate before the vaccine. Don't load yourself up on ibuprofen. Non-steroidals are your ibuprofens, your Motrins, your Aleve. Don't take those things prior to the vaccine. But they also go on to say, if you're having severe symptoms, side effects, that again, super achiness or fever after, they're not saying you can't take those to help you out. So again, don't pre-medicate, but they do not say you can't take those to help your side effects. As far as managing the side effects of the COVID-19 vaccine, we're really, again, local heat or warmth to the area if you're experiencing some discomfort to the area of the vaccine, and managing your symptoms after as best you can without medicating. But if you do need to take medication like Tylenol or non-steroidals, the CDC is not stating right now that you can't do that to help you with those side effects.
And as the pediatrician in the room, I always tell my parents, don't pre-medicate before you get a vaccine for Two reasons primarily. One, if you take Motrin or ibuprofen or even Tylenol before you get your vaccine, you're taking it so that you won't have any side effects or swelling or irritation after you get the vaccine. But here's the problem. If you take those medications and you have no swelling, you have no side effects, is it because you took medication or is it because you weren't going to have any side effects either way? You don't know. So for this reason, I tell people, wait so you know what your body does and you can respond accordingly. If you treat something before it's a problem, then and it doesn't become a problem, you don't know what came first, the chicken or the egg. So you always want to be informed about your body. I'm going to touch on a question that I've actually gotten a few times, and so has Emily. So please, Dr. Vincent, feel free to jump in this one. But the question is, why are so many in the medical field not taking the vaccine? So, believe it or not, we in the medical field are human. And we have the same concerns and fears and preconceived notions as the next person. And it has been my experience, at least from what I hear and what I've seen, that it's not so much people in the medical field aren't getting the vaccine. It's you look at a hospital in general, and the vaccine is offered in the hospital because everybody who works in the hospital can be exposed. And it's not really so much the doctors that I don't see getting it. It's usually other ancillary staff. Some of the nurses are hesitant, the speech therapist is hesitant, the person who works in the lab or the cafeteria is hesitant, not necessarily the physicians. And again, it comes to fear and lack of information. And even those who work in the medical field, I try to lead by example. Both Emily and I have both gotten our vaccines, and we have gotten two different vaccines, interestingly enough. She got the Pfizer, I got the Moderna. We compare notes. But I try to lead by example. If you've had COVID before, you should still get your vaccine. If you have any health problems that put you at higher risk of illness, more than likely you need to get this vaccine because you're more likely to get sick and have bigger complications from COVID in general. So it's the lesser of the two evils. If you deem a vaccine to be evil, I'm using that terminology, I am more likely to deal better with minor side effects from a vaccine than I am to go up against the devil himself. Okay. So it's all about education, and I try to keep educating people as much as possible. Everybody's nervous. Everybody has unique health situations. And so I have actually had teachers at my child's school ask me, well, you know, I have lupus and I have this and I have that. And I always say, one, talk to your physician. And two, if you have these other comorbid illnesses, you are probably going to wrestle and win versus the vaccine than wrestle and win versus COVID without the vaccine. So I'm all about hedging bets. Hedge your bets.
Absolutely. I think just to kind of emphasize what you said, you know, we're all human. And I admit that when the vaccine first came out, I too was trepidatious. And it really was, it's not only lack of information, but again, misinformation, which we talked, you know, for at length about the myths that are out there. It's so easy to go online and find fear mongering or lack of validated studies. You know, there's just more misinformation than there is good information. So I took the time, I did the research, I really made myself feel pretty comfortable that this was safe and going to be much better than getting COVID itself. So like Tracy said, I got Pfizer, she got Moderna, and I think we did pretty well so far with the first vaccine. My friends who are physicians who have had a mixture of both, some had, you know, Pfizer, some had Moderna, a few side effects in a couple of them, but for the most part, all of us did really well. So that's comforting as well. And my dad had it. I'm so happy about that. And he, man, not a single symptom at all from the first or second vaccine. And now I just feel so comfortable that he's, you know, when he's out and about and around around the grandkids. My in-laws also had it. So it's just, it's going to be, as you see people getting the vaccine and people you get the vaccine that you love, you're going to feel good about the things that we can start doing again, really are. So let's
Absolutely.
see. I think that there was another question that I wanted to address. Yes. Okay. I'm going to address this question that was posed to us about, basically, I'll sum it up as, can we be over vaccinated? And concerns about, now we're required to take the flu vaccine and the COVID vaccine and the pneumonia vaccine and all the vaccines that we're required to get. So
Actually, Emily, I'm sorry, I'm going to have to cut you off. They're telling us we got to go. They're kicking us out.
okay.
But we can answer those questions in the comments,
I was
because I
going to
have
say,
questions.
try to
I have a
answer that
question.
question in the comments section. It was
Yes.
great for everyone to be here with us today. This, obviously provided a lot of robust discussion for us and a lot of interest with the questions that we've had. So thanks, Dr. Lemelle, for joining me today. I want to remind all of you, as a final tip, if you have all those chronic conditions that we were talking about, or illness, injury that you're going through, we have health coaches at Blue Cross and Blue Shield that are available to you. Other insurance providers also have the same thing, but this is at zero cost to the Blue Cross and Blue Shield members. And there's the website, bcbsla.com/stronger. Reach out to one of our health coaches. They are just excited to be there and help you and coach you through your illnesses, your injuries. And again, it's a free service. So please take advantage of that.
Yes, and our care team and others will be hosting some upcoming Facebook broadcasts that I want to let you guys know about. Hold on, they were supposed to put up a graphic. I'm waiting for my graphic, but if we don't have that graphic, it's okay. You can always go to bcbsla.com to see what upcoming podcast and broadcasts we have for Facebook Live. We were so happy to be here today and so eager to spread the information and the knowledge that we have. And we will try to, again, answer any other questions in the comments section. And, we're always happy to come back and talk some more. We love talking. Right. So thank you so much. You can also subscribe to our Blue Cross YouTube channel for more videos and resources. Thank you, everybody, for joining us. It was our pleasure. Thank you, Emily. It's been a blast.
Are we off?